Thank you. All right. Good morning, everyone. Can everybody hear me? I don't think anybody's ever answered no to that question. Clearly, I'm not shy. My name is Rhea, and I am one of the co-chairs of this year's Empowerment Congress Summit, as well as the co-chair for our Empowerment Congress Homelessness Working Group. And I am leading our Homelessness EC Summit 33 Homelessness Workshop today. Today, we will be focusing on, pursuant to our theme, where do we go from here, chaos or democracy? The title of our workshop is What Does Measure A Mean for South LA? I'm going to start off by setting some context for us. I'd love to make sure we're just all on the same page. I know we had great panels this morning, and I don't know about you all, but my mind is going in many different directions. I have 1,000 more questions than I started off with this morning. And so I'd like to kind of help us contextualize for Measure A and what it means for South LA. I have the best backdrop today, and it is my 4 amazing panelists. So please join me in giving them a hand. After our workshop, we're going to delve into some questions with them. They are here because they look prettier than, the wall, but also sometimes it's just easier to adjust into your seat now. So let's start off with what is Measure A and what does it mean for South LA? Oh, my screen's having a party, but I always like to give a shout out and a nod to our Empowerment Congress founder, Supervisor Mark Ridley Thomas. 33 years ago, he started what was called an experiment in participatory democracy and civic engagement, and 33 years later, here we are. So we're very grateful for his vision and continued leadership. What is Measure A? Okay, my projector's having a party. Well, I can keep talking. So what do we know about Measure A? Measure A is a half-cent sales tax to be implemented throughout LA County. It passed this past 2024 election, and it takes effect starting April 1st, 2025. We're gonna go old school here. It's okay. What's the purpose of Measure A? Well, the purpose of it, per the language of the measure, is to maintain, I'm just gonna do this, we're good. Thank you. All right, the purpose of the measure, please don't mind my Apple assistant today, is to maintain all existing homelessness and housing services to support people currently experiencing homelessness in finding permanent solutions while doing even more to prevent homelessness in Los Angeles County. One of the things that I'd like to emphasize is we always talk about in our Empowerment Congress, and something that Supervisor Mark Ridley Thomas really mentions to us and helps us understand, is that homelessness is the moral crisis of our times. That's why we hear consistently so much, whether it is in politics, whether it is in social services, whether it's in the news, whether it's at a dinner party, or why you see so many of our fellow Angelenos experiencing homelessness. It is the moral crisis of our time, and it is something really important for all of us, especially as fellow Angelenos, to address together. So I'd really like us to think about that as we contextualize this Measure A presentation. Measure A came from Measure H. I don't know if everybody remembers, but Measure H was a 1/4-cent sales tax that was throughout the county of Los Angeles to come up with innovative solutions and strategies to end and prevent homelessness. Didn't see that light coming, but I walked into it. So from Measure A, it was started in 2017, and it was set to expire in 2027. Measure H gave us some wonderful opportunities to address homeless services, to support fellow Angelenos who are service providers, fellow Angelenos experiencing homelessness, and fellow Angelenos who are community members who wanted to make a difference and have an understanding about homelessness in Los Angeles County. Measure H is set to sunset in 2027. And so they decided, how do we continue that and set in a measure that will not expire? Measure H needed a 2/3 vote to pass. They came up with Measure A, which it replaces the quarter-cent sales tax throughout LA County, turns it into a half-cent sales tax. Certain goods are exempt from the sales tax. This measure is also, unlike its preceding measure, Measure A is indefinite. It's going to continue for as long as we need it. This measure also needed a simple majority to pass. And as we think about that, that's really important because it really reifies the need for the measure. It reifies what Angelinos are expressing, wanting, and experiencing as it pertains to homelessness. There are 5 goals in Measure A. 1, increase the number of people moving from encampments into permanent housing to reduce unsheltered homelessness. 2, to reduce the number of people with mental illness and/or substance use disorders who experience homelessness. 3, increase the number of people permanently leaving homelessness. 4, prevent people from falling into homelessness. And 5, increase the number of affordable housing units in Los Angeles County. Hi, Dr. Barbara. Hi. Good to see you. These goals are to be established every 5 years with regular oversight and reporting. I'm quickly going to go through 2 more items to finish setting the context so we can jump in with our panelists. Measure A has about 11 target populations. That includes veterans, seniors, TAY, transition age youth, families with children, people with disabilities, people with animal companions, women, members of the LGBTQIA+ communities, survivors of domestic violence, overrepresented racial or ethnic groups, and others at risk of experiencing homelessness. I think it's really important to note on that slide, it actually was different boxes of people. Sometimes in homeless services and in life, we categorize people into boxes. As we think about Measure A, what does that mean for robust, comprehensive services if we continue to kind of categorize service populations? Measure A also says we need comprehensive homeless services. Okay, so we put it in 2 buckets, including preventing homelessness, mental health, outpatient residential and substance use treatment, case management and outreach services, employment services, expedited placements in permanent housing, enhanced emergency housing and interim housing, enhanced services for transition age youth, and affordable housing for people at risk of or at risk of experiencing homelessness. With that, I hope that we've kind of gotten a deeper understanding of Measure A and really context as we delve into what does this measure mean for South LA. I had a really great slide with headshots of all of our panelists that you see before us. So I am going to show it because they're great pictures. So, and this was going to be our background slide. So please join me in welcoming all of our panelists. All right. This we're going to need. Oh, I know, it's okay. Yeah, thank you. Oh, thank you. All right, good morning, panelists. Good morning. Or maybe afternoon now. Thank you for taking the time to join us this Saturday. Before we delve in, I'd love to, 1, thank you all for being here, and 2, just ask each of you to introduce yourselves. Well, shall we start with you, Ms. Reba, and move down the line?
Good afternoon,
Thanks.
everyone. Reba Stevens, community advocate.
Good morning or afternoon, Veronica Lewis from HOPIX, also from the Black People Experiencing Homelessness Steering Committee, and representing our region at the state level related to some racial equity stuff as well.
Good morning or good afternoon, Belinda Allen. I'm the Executive Director of West Angeles Community Development Corporation and also the President of the Los Angeles Affordable Housing Commissioner.
Hello, I'm Al Ballesteros. I'm the Chief Executive Officer of Wesley Health Centers.
Thank you all so much, one, for your introductions, for introducing yourself, and for the work that you do. You know, as we think about Measure A and homelessness and Los Angeles County, I'd really like us to consider that we have 4 expert panelists here who all provide a certain level of expertise, insight, continued guidance, and amazing servant leadership. One thing that I would also like us to consider, though, is not only are our service providers, they're also fellow Angelenos. And so with that, I say context is really important. And as we think about how homelessness is the moral crisis of our time and is the humanitarian crisis that affects not only our county, but also our nation and arguably, globally, I think it's important for our audience to recognize that as panelists, you, like I mentioned, are not only experts in what you do, but you're fellow Angelenos. So I would really like to ask all of you your input on Measure A, both professionally and if you'd like to share personally. So maybe I will start with Veronica, if that's okay.
Sure.
Thank you.
Yeah, thank you. Measure A is really important because it continues to allows us to continue to fund some critical services. We, along with many other organizations and community advocates, were very instrumental in helping to finalize the language. And so what I'll say about Measure A that we're most excited about is that it tried to address some of the things that we learned, some of the challenges that we experienced with Measure H, and some of the disparities and equities that we've seen for the last 7 years. And so the fact that there's like a pay equity and a parity clause to make sure that we move in a direction where service providers, employees can make the same that county and, lots of employees make, and that cost of living considerations are built in is really important. The fact that there's equity language is really important. You heard me talk about equity. And so I think from that perspective is great. Also, because there's greater accountability, I think that hopefully we can begin to really use the data and shift to stop doing things that don't yield the outcomes that we want and do more of the things that do. I'm born and raised in South LA, have deep connections in South LA. Hopics, if you've never heard of us, we are your leading agency that is providing homeless and housing services in South LA, Compton, and other surrounding areas. And so, and unfortunately, we're one of the most marginalized communities. Spot 6 continues to be under-resourced in many ways, even though we have, in the last 11 years, intentionally and strategically made sure that our voices are now heard in a different way. There's recognition that there's competency and capacity within our own region, and we don't need everybody else coming inside. From the outside, we've built the infrastructure of a lot of the smaller organizations. We've continued to make sure that the system leaders understand the unique nuances in South LA and some of the other complex barriers because of long-term system inequities. And so I think that for this region in particular, as folks are coming, and I may be jumping into your next question, but we're excited to Measure A pass, but the real work and making sure that we get our fair share for South LA and that the programs and policies and systems make sense for our folks in South LA is happening right now. So all the conversations that are happening at all these different levels, right, our elected leaders, all these other bodies that are figuring out how to implement it, this is the time where we need all of you to be in the business, be involved, to make sure that how Measure A is rolled out is what we intended it to look like. And that the equity piece doesn't get pushed to the side. You all know the the environment we're in, where equity and inclusion is a bad word, right, federally, and a lot of our dollars are still tied to federal funds. And so it's really important that we make sure that as the nuts and bolts of Measure A's implementation is being worked out, the South LA is not left out, and that our needs and nuances are considered. But I'm excited about it, cautiously optimistic.
Okay.
But we need to be involved right now as the decisions are being made around how the resources are going to be used. And I have more to say about some other things related to that later.
Awesome, because I have more to ask. Thank you, Veronica. Reva, what are your thoughts on Measure A coming from your community advocate perspective and the perspective of lived experience?
Well, I think it's really important. First, I want to say thank you. Thank you for the opportunity to participate, particularly on this panel, but also a great thanks to the Empowerment Congress. So I was not a true supporter of Measure A, and I think I need to be open and honest and transparent there to begin with. I was a huge supporter of Measure H, which Measure A is to complement at this particular time. And I think it's also, because I was so bold to say what I'm saying now, it's important that I also share with you why I struggled. And I struggled because as a person with lived experience of 21 years of being unhoused and having an experience of being served through systems that don't exist today but existed then, and understanding the importance of really meeting people where they are, not just a slogan or a statement, but empowering and building us, allowing us the opportunity to not only be ourselves, but to see ourselves and make the necessary adjustments while being provided a safe, healthy place to stay. So I have a lot to compare to. And in addition to that, another tax. Are you kidding me? More money? How much money do we need? Was also some of the questions in which I had raised within myself. Because one of the things that our leader in SPA 6, Hopics, Veronica Lewis, had talked about was the equity, and she also uplifted accountability, but what does that actually mean? And so I was never really clear and sold on the accountability piece. And so when we're reaching out to the community to educate and inform the community, I think it's also important that we're not only looking for equity, we're looking for racial equity,
Yes.
we're looking for accountability, and how does that is to be defined? I think we should also be asking this panel and others and those who are heavily involved to clarify and define accountability, to clarify and define equity. So as a community advocate, it is really important that I am here as a representative for every single individual who is currently newly housed, for those who are unhoused, as well as those who are facing becoming unhoused, either for the first time or again. So you're going to probably hear a little slight difference from me, but this is really about my moment and my opportunity to not only be on this panel, but to hold those who are present here with us today also accountable.
Thank you, Reba. Thank you for also sharing your truth with us, knowing this is a safe space and we welcome it. You've heard from two of our panelists, and they've already shared additional information that we're going to hear later in this panel. So clearly you know why they're all here, because they are experts in what they do. And I'm going to pass it on to Belinda to kind of share your perspective coming from both the faith-based community and as a developer on your thoughts on Measure A, please.
Thank you.
Yeah.
But on that note, I think we also need to clarify and define affordability, because we talk
Yes.
about 100% affordability, but that's, I would say, almost 100% of the reason we have so many homeless individuals, because afford is not in affordability. So we definitely need to clarify and define that, number one.
Yep.
So again, first of all, at West Angeles CDC, we actually have programs. So I do like Measure A because it gives us accountability, because without that accountability, without those stats, you don't know how to get to the next step, right? So that's going to force us to get to the next step. And at West Angeles CDC, we actually practice Measure A. We have various programs for the homeless, or we call it the unhoused community, because when they come to our office, they feel better when we use the word unhoused versus someone who is homeless. And we have our case managers who work with them almost 24/7. I don't want to go back to COVID, but during COVID, when everything was closed down, our CDC was there 24/7, helping all those who were homeless, making sure that they were getting into housing. We own 500 affordable, and I'm going to have to use affordable for right now because we haven't clarified it or redefined it yet. So for now, we do have 500 units in our affordable housing projects, and of that 200, we house our seniors. And then, believe it or not, the last one we built was just before COVID. That was our 70 unit. We had an outreach for the community like 3 months before we opened in October. We had over 2,000 seniors who came to that outreach. We didn't even have room to seat them. We had to go and just find chairs. You know, usually you have an event, you have somebody just stand up in the overflow. But we're like, these are seniors. We can't let them just stand up. We've got to go get chairs and accommodate them. But my point is, some of those seniors today are probably out homeless, right? Because they're knocking, trying to get in, but we need more affordable. And West Angeles is ready. We have, there's a vacant lot right down the street on 54th and Crenshaw. We have a developer who's ready to work with us, but then there's a lot of red tape. So that's another problem. That's why there's homelessness too. We talk about getting rid of it. We talk about, well, the Bible says the poor you'll always have with you, right? So we may be able to bring it down some, reduce it, but I don't think we'll ever eradicate it, right? But in the meantime, we want to do like the United Way slogan. How do you bite an elephant? One bite at a time, right? So we want to keep bringing in one person individually at a time. And as we take note with these individuals, again, like our case managers do, at the end of the year, we have to give an impact report. And that's how we are accountable. That means how many did we bring in off the streets? Of that, how many actually were housed permanently? Because first is temporary housing. And we work with them, make sure, you know, do you need a job? You know, just assessing them. And some of them have success stories. I can tell you about one gentleman who's going to be on my video at our 31st gala that's coming up next month.
Before we get there, though, Belinda,
Yes,
may
don't
I,
tell about him.
Yeah, not yet. I mean,
Okay.
May we hold on to his story, because I'd also love to hear from Al about JWCH and their perspective on Measure A.
Great. Well, thank you very much for
Yes.
inviting, and thank you to
Of course.
the other panelists to be here with them. Well, I mean, my perspective comes from being primarily a medical services provider. So prior to to Prop H, which was the original, you know, we provide medical care just like, you know, all of us. Hopefully you have a regular doctor that we go to. But we were primarily serving homeless individuals, and I believe in the year that that Prop H passed, we had served about 16,000 homeless individuals with medical care. And I will tell you that you can provide the best possible medical care that money can buy, but then to send an individual back out to the street to sleep isn't going to do much good.
Right.
So I saw that perspective. I saw our doctors treating individuals and trying to do the best they could for them while they were right on the street, and that was wrong. It is wrong. It is unconscionable. So then Prop H passes. And what that did for those individuals then that are in that segment of individuals that are unhoused, that are sick, that are perhaps dealing with substance misuse problem, dealing with mental health challenges, it gave them the undergirding of a place to live, clean beddings, a place to take a shower, meals, while they're getting the medical care. And we have documented evidence that that model has worked.
Sure.
That was at risk of going away had Prop A not passed, had Measure A not passed.
Sure.
That was at risk of going away.
Right.
The very building that we're sitting in, there are 96 individuals living on the second and the third floor above us that are exactly the population that I am describing, that are the beneficiaries of a comprehensive system of medical care and now housing and support services because of Measure A.
Thank you so much, Al. I would like for everybody to also know, please, one, join me in giving a huge thank you to Al Ballesteros, because the building that we are in is the JWCH Recuperative Care Center. And so, one, thank you for opening and sharing your space with us. And two, as we think about Measure A, the impact of Measure H, the hopefully continued impact of Measure A, you mentioned that the setting that we're in right now is an example of the positives of Measure H and potentially of Measure A. Before we go into our next question, may I ask you to expand on that a little bit for us?
Sure.
Thank you.
I can. And it goes back to what I said earlier, that you can provide, the system can provide an individual with the best medical care, mental health care that money can buy. But if you're sending that individual, if that individual has to go out and sleep on a cold sidewalk and have nothing, then none of that really makes a difference.
Right.
In my opinion.
Right.
And so I think the impact of Measure A and what it's going to do in the future is going to foster that even further when we're able to bring that out to more individuals that need that help.
Great. Thank you. As we heard from each of our panelists on their perspective of Measure A, both personally and professionally, even though we had some variation of perspective, I hope our audience, you would agree that we heard some commonalities in all of them. One, accountability for Measure A. Two, affordability and housing, right? And three, we also heard about needing to understand the context of the environment. And so with that, I would like to bring it to us here in South Los Angeles to really understand what are the requisite impacts of Measure A. How do we make sure Measure A fulfills the promise of accountability? Because if I may redirect everybody's attention for a moment, Measure A has 5 goals. It's increasing the number of our fellow Angelenos moving from encampments into permanent housing. It is reducing the number of people with mental health and or substance use disorders or barriers who are experiencing homelessness. It is increasing the number of people permanently leaving, experiencing homelessness, and moving into what I like to call homefulness, home. It is preventing people from falling into homelessness and increasing the number of affordable housing units in Los Angeles County. Each of our panelists, when they were sharing their perspective on Measure A, touched on aspects of that. So I'd like to ask each of you, all of you have work that is based here in our South LA community. As Veronica shared, you're from this community, you work in this community, and I really appreciate your perspective of it's not necessarily that we need people coming from the outside of our communities to tell us what to do in them. No. How do we utilize the resources available and help those resources hold them accountable to saying we need to empower our communities, we need to make sure your measures empower our communities to serve our communities, because that is how we get sustainability, right? And so with that, I'd like to ask, within South LA and the services you provide, what is paramount to understanding that accountability and transparency piece of Measure A? So I will start with Al, and then I'm going to bounce around. And Al, I'm going to ask for JWCH and the services that you provide and the accountability and transparency piece that we have seen being driven throughout with Measure A. What does that mean for JWCH? What does accountability look like from Measure A, and what does successful accountability look like?
Well, first up, I think that Wesley, JWCH, we've been around for about 65 years as a medical organization. And what we've always done is work through collaboration, try to seek to understand what is needed. Mm-hmm. So I think that what's important with respect to Measure A would be, to what extent do gaps in care, to what extent do any unresolved needs come into play from the old Measure H? Okay, so there were some great additions that were made into this new rendition of Measure A, but what is lacking? Mm-hmm. What does the community assessment see for South LA? Okay, I think that's the first thing for us all to understand, because, not all communities received equitable services through the original rendition of this. And so I think first and foremost, there needs to be a correction of that. And then I believe then we look at the models that have been successful. And I think that accountability is, showing that data, showing the models out there that have been successful. If something's worked, it's good. If something hasn't worked, then call it out. I think that's what accountability is.
Thank you. Veronica, would you like to share from your perspective and the perspective of HOPICS, what does accountability look like, and what is good accountability as it pertains to Measure A and the promises of services?
Yeah, I think a little bit more framing potentially, because we shouldn't assume everybody in here knows the key aspects of what Measure A is paying for. So, and it's tied to your question.
Sure, go for it.
But generally, how many of you think you understand all the different aspects of addressing homelessness and homeless prevention that Measure A pays for, by a show of hands? Is my mic on? Okay.
Yep.
How many of you feel like you understand generally the things that Measure A is paying for to address homelessness and try to prevent it? Okay, a few hands. So really quickly, there's lots of folks unfortunately living on the streets, South LA and surrounding areas. And so there's a significant investment in multidisciplinary outreach teams that have people that are formerly homeless themselves, mental health, substance use clinicians, nurses, et cetera, that are literally trying to stop people from dying while living outdoors. And there's a lot of work in collaboration that we're doing with street medicine to actually bring the medical doctors and physicians outdoors as well. And then for people who are willing and able to walk into these triage centers, it's paying for essentially air traffic control and ideally being able to link people to different services through these access and triage centers. And we only have one navigation center in South LA where people can shower and use restrooms. There's several in Skid Row. That's something I'm gonna talk about in a second. Mm-hmm. We're grateful to be the first, but there's only one to allow people to restore dignity by taking showers, using the restroom indoors, et cetera. And then there's a lot of permanent housing stuff. And then there's thousands of people being kept off the street in interim housing. And there's some investment in providing supportive services as people become permanently housed, because a lot of times the layers unpeel once the housing crisis is over, and we have to be there to address other things. There's also currently an investment in local regional coordination, which I'm going to talk about. And obviously there's other ancillary things, but those are the high level things. And the only other thing I'll add is prevention, right? An array of prevention supports to try to stop people from becoming homeless. And that's through a variety of things. And so I think that for me, when I hear about accountability as it relates to all those different things, one of the things that comes to mind is there has been a very difficult tug of war in our system, including how resources for Measure H and now what would be Measure A are going to be allocated, because you have folks that are living outdoors already. And in South LA, unfortunately, we have a lot of people that have been living on the margins, piecemealing it, barely making ends meet forever. And because of the economic environment, the bottom has fallen out, right? It's fallen out for them, it's fallen out for their loved ones, it's fallen out for the people who they could have gone to. And so this tug of war about where does the money go? Do we get people out of squalor and leave these folks to figure it out? Or do we have a balanced approach?
Right.
And so the first thing I would say is some accountability and thoughtfulness around a balanced approach. There's some other overlays, unfortunately, where they're using our Measure A tax dollars to pay for court cases and settlements and other things that is unbalancing. Meaning that I want to move everybody off the street.
Right.
But it's left us in a position where a lot of people walking through our doors that we used to be able to help, we can't anymore, right? So transparency, thoughtfulness, alignment, maximization of all the resources, not just Measure A, to come up with a balanced approach to address all the different aspects and facets of people that are unhoused and precariously housed is something that is sorely lacking in LA County, and we need that. And because Measure A is the primary local investment where we have discretion, and it's not governed by the federal and state regulation, we need to be very thoughtful about it, and that's lacking. So balancing how we serve all the folks that are in housing crisis is something that needs to happen. Secondly, really looking at the policies and program designs that we have long expressed frustration about, and we get it. A lot of our programs are built for fraud prevention. I don't know if you all know that. And unfortunately, South LA has the largest number of families with children experiencing homelessness. If you don't know that, everybody talks about Skid Row. our region, and we know it because they come through our doors, we serve them.
Yep.
Hopix alone is keeping over 300 families off the street every single night, including, that includes about 300 to 400 kids. But we are the most impacted in terms of family homelessness. And I can tell you that DPSS being one of the largest contributors to that, most of our programs are fraud prevention based. It's not person-centered. We got to make sure you are, and I get it, it's taxpayer dollars, there should be accountability, but the structure and nature of the way that we're having to do this work and the way that we're having to interact with people because of disallowances on the back end, if you don't do what the funder said, it's ridiculous and it doesn't make sense. And we've had 5,000 focus groups, listening sessions, and we got all the strategies in writing. And I think that stepping back to really make sure that what we know works is what's funded, what we know doesn't work is no longer funded, and innovation that a lot of us have done outside of the system that we've demonstrated has worked is taken to scale. And so thoughtful utilization of the funds is another aspect of accountability. The other thing is related to the equity piece. And again, I'm gonna keep saying this because a lot of you have seen beautiful presentations from our system leadership that have 3 slides that say equity on it. And I can tell you, when you ask one question about what does that really mean, deer in headlights.
Right.
And Reba and I have been on the Black People Experiencing Homelessness Committee for 6 years or 7 years or whatever it is. We have heard people talk about frameworks, but for the most part, our system is still reactive. They look at the data to see if anybody's been harmed. I'm not exaggerating. When you ask, what are you doing? We're looking at the data to see if there's any disparities, as opposed to proactive implementation of equity frameworks and prioritization. And so really making sure that there are defined ways in which there's going to be proactive attempts to try to reduce disparities and not just looking at the data afterwards and saying, oops, and fixing it on the back end, which is how our system operates now. Just in case you didn't know, as it relates to equity, it's critically important. I think also, there's a lot under accountability, but the last thing I'll say is certainly the service providers need to be held accountable and the measures need to make sense, right? Our funders and grant administrators, and it's not just lots of DHS, DMH, there's lots of county departments that operate and administer DPH, Measure A funds. And so really having clear measures. And the final thing, which overlays with some of the other activities in LA County that I'll say is, who is ultimately responsible for the system? Because when things don't make sense, and advocates and participants and organizations there's an outcry. It's like this. Between LASA, the city, the county, DMH, DHS, there's nobody accountable. I know there's some, potential things happening, but we need to be clear about who is ultimately responsible. And given that the county is administering it, it should be the county. Right. And if the county is responsible, they need to be holding the grant administrators accountable and the service providers and everybody else that's a part of it. But we need to be clear about what's the hierarchy, who ultimately needs to make decisions to change things, since we're looking at metrics in a different way under Measure A. So there can be a system leader that can be held accountable and make decisions, as opposed to all this hemming and hawing about they decided that, we decided that. So I got more to say, but I'll stop there in the interest of time.
I want to ask a follow-up question and then pass it to Reba, and then I'm going to dig in with Belinda on the development side. As oftentimes when I'm hearing you talk about homeless services systems and service providers, and it's very important for our community and our audience to understand those are not one and the same. And I would like to hear, Veronica, if you could dig into that a little bit more for us, because I really want this point to hit home as we've been talking about context matters. And our theme for this year's summit is, where do we go from here? Chaos or democracy? I think going towards democracy or sustaining democracy can only happen when we have a clear understanding of context and of systems. And so in this case, I'm going to ask Veronica, can you dig into that a little bit with us and for us, so that our audience also understands the difference between being a funding administrator and service system administrator versus being a service provider. Because too often when we receive backlash about homeless services, the service providers are the ones who are straight up attacked, while these service systems administrators, people don't even know that they have a role or responsibility. So
I wouldn't say they don't know; they just don't. So yeah, it's there's so many narratives about HOPICS.
thank you.
And some of them might be true, right? And we're,
Sure.
we're actively in process improvement, focusing on customer service, doing some things. So I just want to acknowledge that it's not perfect, and I know that, and we're working on it. But many of the narratives and murmurs have nothing to do with things that we control, right? And so while we are a part of the system, proud to be a part of some of the shifts that have happened over the last 11 years, you all need to understand we're one of the biggest fighters of the system, right? We're one of the loudest voices that are pushing. Now, we publicly, you may not see that, publicly you may, but we are constantly trying to improve things. But ultimately, some of the ways in which we have to function and that we have to interact with participants is governed by the policies of the funders that we have. And just so you know, if we don't do those things, there's a $50, $70, $100, and $200,000 bill on the back end that says you did not follow this protocol. These dollars are disallowed. I just got a letter 2 days ago that if y'all don't show this, you got to pay $76,000 back. And so, listen, we're one of the few organizations that probably buck the system than most of the time, right? One of my associate directors is in here, and he could tell you one of my most common terms is, "We're not doing that." When they say like, so-and-so said, "We're not doing that."
Yeah.
So and I say, we're not doing that. And so I say it all the time, but also obviously I have a fiduciary responsibility,
Right.
and ultimately have to think about the sustainability of our funding. And some of the ways our programs are designed, we don't have any control over. And there's some wiggle room for interpretation, but not. And so the service providers are required to adhere to the things that the system leaders, so that's the County of Los Angeles, that's the grant administrators, LASA, DHS, DMH, BPH being the largest ones related to Measure A. And while we are internally pushing for things to change, providing evidence, providing data, sometimes it moves and sometimes it doesn't.
Right.
And when I say we're pushing, that means we're going to the board offices, we're going to the city council offices. In some cases, we jump to the state. We are actively trying to improve the system at the same time that we're a part of it. We're funded by it. Unfortunately, we're beholden to it because we don't have as many private dollars as we would like to be able to be like, forget that, let's do it over here. And so it's a balancing act, but a lot of the frustrations around lack of availability, around some of the structured ways that we interact, are system decisions. So when you heard me talk about in response to the previous question around making sure we have person-centered, common sense, logical policies, program designs, and resource allocations that govern how we do our work, that's what I meant. Because there's a lot of stuff that doesn't make sense, right? And again, sometimes we ain't doing that, and they can fight me, tell them to call me, right, is what I say. And most of the time we win because it just doesn't make sense, and it's not person-centered. And other times, we gotta fall in line, or we're not gonna get paid, and we can't continue to do our work. And so, part of what I said too, and I'll close here around, and hopefully you ask me a question around what's happening right now in terms of the current potential allocation. Part of the reason I said in my comments at the top around it's important for everybody in this room to get involved is because those decisions around if things are just going to continue to be the way they are in terms of policies and program designs for Measure A come July 1 versus if there are going to be any shifts to put in place the lessons learned or have the lessons learned reform, those decisions are happening right now.
Right.
And I'm a loud voice. Most people know that. It can't just be us though. We need the whole community to get involved and say, we understand this is not working.
Yep.
There's some challenges in particular in South LA with these models. And we want to make sure there's some reconsideration before you just move forward with the existing scopes of works and the existing things we've done and just change it to Measure A from Measure H.
Right. Thank you so much, Veronica. And reciprocal accountability, I think what Veronica is sharing is very much emphasized, and that is the only way for accountability is reciprocal accountability. It's providers holding the systems accountable, systems holding potentially providers accountable in their whole system. What you're hearing about Veronica's agency is also, Veronica runs a great agency. Hopics is amazing and runs well. Unfortunately, that's not true of all agencies. We all have some room for growth sometimes, but overall, I do think it's very important for people to understand that as these services and funding are allocated, when we talk about service providers and service administrators or systems administrator, those are two different perspectives. With that, I'd like to pass it on to Reba to, also share your perspective about the accountability piece, and I know you had some stuff you wanted to respond to.
Yeah, I truly believe it begins and ends with me, and it begins and ends with me because I care. It begins and ends with me because I've experienced it. And I believe that there is so much more to learn with the new system. I've been housed for many, many, many years. I haven't experienced being unhoused in a very, very long time. But I still feel and experience the impact because of what I see on the streets. And it's painful. And so I feel that it is my responsibility to hold myself accountable, but also to educate you on why you could also be a part of the accountability. And one is to educate yourself. Look at here, y'all. It's so big, it's so much. How many of you know who your homeless deputies are? Homeless deputies for the Board of Supervisors. How many of you are aware of the homeless initiative? Great. I'm so glad to see you. How many of you are aware of SPA 6 Homeless Coalition? How many of you today did not know who Veronica Lewis is? And the reason I'm calling her out is because she is our lead agency director. But how many of you did not know? And so this is like the beginning. And so we have to begin to think about, for me, accountability begins with a foundation. And it can be very, very simple. Just the beginning stages of me being awoke and aware of what's going on. Not just what I'm seeing outside, but to truly understand how the system is formed. And I want to make certain that we're also looking at the many intersections in which folks who are experiencing being unhoused are also experiencing. When Veronica Lewis mentioned DPSS, I kind of cringed, because one of the things that I know is that DPSS is also assisting in those who are unhoused. However, they're giving up 16 days for you to go into a motel. So then what happens on day 17? But day 16, on day 15 or 16, you still can't go to the agency or any of our agencies seeking assistance, because you need that first assistance that they've given you 16 days, even on day 14, to get more assistance or additional assistance. So what are we doing? This is why accountability is also about recognizing when we are wasting dollars, when we are affecting folks' safety and security, and not one to relax. Now, I ain't tell y'all that I utilize mental health services, so I really understand what it's like to be stressed, depressed, and what that feels like. Fortunately, today, I don't experience it to the degree in which I once did. But it's really important to have that conversation. And not to mention that we're not talking about Measure A and substance use disorder and integrated services that are critically important. And our stores touched on it. And we know that our lead agency also provides HOPICS, provides wraparound and integrated care and services. But how is that funded? And how are we ensuring that people are really getting that wraparound assistance and support? So if the numbers continue to rise, that means your caseloads continue to rise. And as those caseloads continue to rise, that means there's less time that you can spend with an individual. I'm going to pin that for a moment. Did you hear what I just said?
Yep.
So when I think about accountability, it's really about all of us being educated and informed, and we can take our time. You don't have to go do it all, but just start noticing, be aware of what conversations are happening, how there is such a great disconnect disconnect. And I'm going to end by saying, because I made a commitment the other day about, speaking of accountability,
Yep.
we have several men who are parenting children
Yep.
in a car. Did you hear what I said?
Yep.
So we think in our minds, we see families and we see women. But do we see that man
Right.
with that girl, his daughter, in a car, in the house? So accountability is about educating ourselves to understand where are the gaps, where are the unmet needs, what is the conversation that ain't being had, and begin to make sure that we, based on our self-accountability, can you raise your hand if you're going to get some accountability? Because I'm holding you to it. I'm taking a mental snapshot right now, and everybody on this panel will tell you that I will come after you.
I believe Reba. Thank you, Reba. As we're talking about services, it keeps continually, of course, it comes up that we also need housing. You hear it from the systems perspective, you hear it from the services provider perspective, you hear it from the developer perspective, you hear it from community perspectives for people who may not be as informed about why we have people experiencing homelessness. So I'd like to turn it over to Belinda, because Belinda, when you were sharing earlier, you brought up something very interesting about affordability. Affordable housing does not equal affordability. Can you share with us what that means, and how do we ensure that the promise of increased affordable housing from Measure A, how do we hold it accountable towards that and move to a place where affordable housing does equal affordability and vice versa?
Okay, thank you.
Yep.
And I just wanted you to know that came from a community outreach. There was a gentleman that said, well, wait a minute, if I live in Watts and you build affordable housing on Crenshaw, but I can't move in, how is it affordable? So that really stuck with us at West Angeles. And so we've been trying to, work with policy, everything that we can, so that we could hopefully change that definition to whatever it really is. And basically that and everything that we're talking about here, this is the start. It's that village. It's coming together like this, bringing in businesses, nonprofit organizations, the city, the bankers, bringing everybody together and getting everybody's thoughts and ideas. And that's one reason, that's one way how we're going to get the right way of what we need to do next. But just at West Angeles, for example, excuse me, this past year we trained over 10,000 clients on financial literacy. And that's a preventive way of not being homelessness. If you have a bank account, if you know how to save money, if you know how to build your credit score so that you can go out and buy a house, all that is a way of alleviating homelessness.
Yep.
Of those 10,000, there were over 200 who actually were first-time home buyers. So they actually purchased their first home. Right? And the unfortunate part about that is they're Angelenos. They're from South LA. I'm from South LA. I'm from 5 minutes to where I'm working right now. I started off in aerospace. I retired, and West Angeles CDC, I was on that board for 20 years, and after 8 months of retirement, they said, Belinda, we need an executive director. And so here I am now, 7 years later, advocating for those families in the same community where I grew up in. And so the unfortunate part is these Angelenos, they qualify eventually, but we can't send them to buy a home in South LA. And of course, that's because of gentrification, right? It's no more here, it's way up. So we have to send them out to Riverside, Lancaster, right? The good news is they are purchasing a house, so it means they will not be counted as one of the homeless individuals. Another program that we have at West Angeles CDC is we actually, as I told you earlier, we have our own 500 affordable units. Well, we're in the process now of building another 400 affordable units. They're supposed to be 100% affordable, but check it out. We started this in 2017. it was only going to be 20% affordable. All the money was in place.
Yep.
We always do an outreach. We did the outreach and everybody was crying, it needs to be 100% affordable. So today, it's going to be 100% affordable. But that's why it's taken so long, because of all the red tape again that I told you about. So it's taken long. I think the total project is 129 million or something like that, and we're missing 7 million now. So we got to fill that gap, but hopefully the plan is to actually break ground this year so that we can have 200 of those homes out the way. Thank you.
Thank you, Belinda. Can you help us understand, as the audience, from a developer perspective, what does it mean when something is 20% affordable versus 100% affordable?
Right, okay. So 20% affordable would be if there's 200 units, for example, then 20 of those units would be, well, if it was 10% that had to be affordable, 20 of those units would be 100% affordable, which means, let's say the medium income in that area that we're building is, I'm just going to throw a number out there. Let's just say it's $50,000, right?
Okay.
And so affordable would mean, and it goes through HUD, it's all organized. You know, there are people that come and say, can you put my name on the list? Are they mad? And they're saying, well, I qualified, my name is on the list, I didn't get the call. HUD goes through a electronic system. So everything goes in there and it pulls out like that. Why do they do that? So that we will not favor anyone. Okay, if your application came in first, you came in number 10, but I know you, I can't just pull that person's application in. But so that LMI, again, if it's $50,000 is what you have to make, and then the LMI may say, after all your expenses, you need to have X amount of dollars that you need to live off of, right? Whatever that amount is, if you over that amount, you don't qualify. Just want you to know that. If you're under that amount, you don't qualify. But if you can get somebody who can sign on with you, because that means, you know, the city want to make sure that they're not taking all your money so that you don't become homeless, right? You need money for entertainment, for insurance, for your car, your refrigerator, all those kind of things. So, but if you can have somebody to sign with you, you can make it. But bottom line, you have to be within that threshold to get into that 20% that we're talking about right now. Now, when we say we finally got it 100% affordable, they're different, I think they're called LMIs, low to moderate income. So there's different levels. It may be 50%, that's going to be the median of $50,000, and then another 20%, it may be if you're making $60,000, right? You can't get in the one that's 50, but now your rent is going to be a little more because now you're in the 60th percentile. But that's how the affordability comes in there.
Okay, thank you. I think Veronica has a
just
question
wanna
from a
say-
service provider perspective with that, right?
We're a developer too now, right? We got our
Right.
first
Oh, congratulations.
years in Compton in summer. And this summer, it's really important to note about South LA, because even though we've seen rents rise, cost of land rise, everybody from across the county has come into South Los Angeles because the land is still some of the least expensive land in the county, and we have developers from all over the place. And also, the one thing I want to think, so when I talk about thoughtfulness around strategies, part of the strategies and some of the, because there was not alignment and because there's been competing programs where DHS Brain Corners can offer a landlord this, somebody else, the prices of our rent have been driven up because of the system, because of lack of coordination.
Okay.
And so when I talk about one of the accountability and thoughtful strategies, everybody's coming to South. If you don't know that, if you look at the map of where the majority of the developments are across our county, it's here. And that's not a bad thing, right? Now we have to fight to make sure people that live here or that are unhoused here get to be housed, and that's where that first come first serve is that's a lack of equity, and that doesn't work for us, and we're still fighting for that part of it. But separate from the actual permanent supportive housing, affordable housing development, I just want to be clear that rents have been driven up, and we see it because we pay landlords all the time,
Right.
because of all these different competing programs. And so one of the things that is really important that we ask for is that there's alignment across all the different county, city programs, and we set standards and maximums and minimums for rent, because literally the rent has been driven. We've seen it in the last 3 years.
Right.
Because of all the competition, because they may have incentives for landlords, we may not have incentives for landlords.
Right.
A landlord committed a unit to us, we call them back and they say, X agency said they would give us more rent. Like, literally those things are happening every day. And so not only are rents being driven up for us that are paying rent for our participants, but people that are just looking regularly for market rate
Right.
rents, we've driven it up because of lack of alignment and so those are the kinds of things that we need to be demanding, in particular because you got people from all the regions, so you all are pushing people out for home ownership, and some of our folks go out, but a lot of people that are serving people in the valleys and all the other places, they're housing them here. So we just need to be thoughtful around, don't run our rents up,
Right.
because we happen to have the least, but those are the kind of things that our elected officials need to hear from everybody. So I just wanted to, affordability in terms of market rate rents is impacted by lack of strategy and lack of alignment in programs as well.
Right. Thank you. We're gonna get to questions at the end. Thank you of our panel. Mr. Ballesteros, Al, I would like to bring it back because each of these aspects of homelessness that we're hearing about are impacted by or impact somebody's health, right? And our health is impacted by potentially experiencing or being at risk of experiencing homelessness. What do we need to understand about that in terms of not just physical health, but also mental health and SUD?
Yeah, well, that's a big